I don't hear anything.
Oh, it's 1 o'clock. Great. All right, we're going to start. Thank you so much, everyone. Thank you for joining us for another excellent Rush Generations Health lecture. I am Grisel Rodriguez Morales, and I am the Manager of Health Promotion and Rush Generations programs at Rush with the Department of Social Work and Community Health. I am very excited to be with you today and to soon be introducing our speakers. Always a pleasure to have great colleagues from Rush University Medical Center with us. I would like to start by showing appreciation to Jasmine Shandy. I know that many of you come to these lectures very regularly, but Jasmine up to now served as the MC or facilitator of these lectures, and she was essential in the creation of this our Rush Generations YouTube channel. So although it was difficult to say goodbye to her, the entire Rush Generations team and many of its members are excited to know that she's on to new and exciting things. So today I'm joined by other talented team members. Patrick Stanley, he's making sure that things go smoothly regarding the live stream and the technology. And soon you'll get to meet the newest member of our team, Danielle or Danny Kill, who will be a key person in us continuing to offer excellent content in these Rush Generations Health lectures, and also key in our Shaman Senior Voices programs. So stay tuned. We hope that you remain connected to our programs. We are delighted to continue informing you, supporting you, especially during these difficult times. So let me introduce our speakers for today. Today, we're gonna start with Dr. Desai. She's an assistant professor at Rush. She's assistant professor with the Rush Institute for Healthy Aging. She also serves as the Rush site co-investigator on the US Pointer study, and she's gonna be speaking about that study. And also she's the Rush site principal investigator on the Pointer Z ancillary study. So we're glad that she's here to speak about those two projects and initiatives, national, with all of you. Then we'll transition and have Dr. Rebecca O'Dwyer. She's been in other lectures before in the past, Rush Generations lectures, so always a delight to have her. She's originally from Dublin, Ireland, and she went to medical school in Munich, Germany before making her way to the Cleveland Clinic, where she completed an epilepsy fellowship. And right before she joined our Rush faculty in 2016, Dr. O'Dwyer went to Georgetown University for her neurology training. And she started the first comprehensive epilepsy clinic for the elderly in the Midwest, and has written many articles on the issue of epilepsy in older adults, which is rampant. And then besides running the neurology residency at Rush, she's actively developing imaging protocols, particular to older adults with epilepsy, and has many clinical trials offered for recruitment. So thank you again for joining us. And what I'm going to do right now is transition. So to have Dr. Desai tell us a little bit more about the pointer study. Let me stop my screen. Take it away, Dr. Desai.
So thank you so much for the opportunity to present today. I'm going to try to share my screen here and slides. Just one moment. So can you see my screen?
Yes, I can see it.
Wonderful. So again, I'm really delighted to have the opportunity to present about the U.S. pointer and its ancillary study today with Rush Generations. And so U.S. pointer is a trial. Pointer is about actually multiple lifestyles and brain health, and the formal title is U.S. Study to Protect Brain Health through Lifestyle Intervention to Reduce Risk. So as you may know, Alzheimer's disease is a public health crisis in the US, as noted by both the Alzheimer's Association and the CDC. It's the sixth leading cause of death in the US, and very costly at $290 billion. And its prevalence is increasing and to be doubled in terms of prevalence over time with increasing older adult population. And also the tracking and monitoring of it is quite limited, with only 16% of individuals saying that they receive regular cognitive assessments. So US Pointer is a large-scale, multi-component trial that's occurring in the US. And so the main purpose of the trial is to really examine how lifestyle changes can impact brain health. So can we reduce risk of cognitive decline through a healthy lifestyle is the primary question. US Pointer is a community-based trial that will test two types of lifestyle interventions, which both encourage physical exercise, a healthy diet, cognitive and social activities, and health monitoring to protect brain health among older adults at risk for memory loss. In terms of potential eligibility to be able to join the study, we would like to recruit potential participants who are between the ages of 60 to 79 years old, who may not be exercising regularly, who may have a diet that is poor in terms of not eating as many fruits and vegetables and other types of foods that would be considered healthy, related to the MIND diet or the Mediterranean types of diets, who have no cognitive impairment at the beginning of the study, and that have two or more risk factors, and that live in the regions where the intervention is occurring. So the intervention is occurring in the Chicagoland area, in North Carolina, in California, in Northern California, in Texas, and in Rhode Island. So it is a multi-site study that's national, and there's also international locations of adapted versions of US Pointer. In order to be, in terms of exclusion or not being able to participate, if your BMI is greater than 40, or if you have neurological disease already, or have active or serious chronic psychiatric disease, or have opioid use or immunocompromised. These are some of the factors associated with not being able to participate. We do have a screening process that's part of the trial. So again, just to summarize, the primary sort of eligibility criteria include, the age range, not exercising regularly, and having risk factors like family history, high blood pressure, cholesterol, and blood sugar. So as I mentioned, Pointer is a multi-site study with the goal of recruiting about 400 participants per site. And as part of the Chicagoland site, Rush is partnering with Advocate Aurora Health System to be able to recruit about 400 participants to take part in the Pointer study. But the total for the trial across the US is about 2,000. And there are two groups in which people are randomly assigned. There's a structured and a self-guided lifestyle group, which I'll talk about a bit more. The total length of the study is about 2 years in which participants would be followed up. There's also some ancillary studies that are part of Pointer. So there is the Pointer imaging study, where participants will have two types of scans that take pictures of the brain, MRI scans, that'll be performed at when the study starts at 12 and 24 months, and PET scans that measure brain amyloid and tau, which will be performed again at the start of the study and at 24 months. For this portion, participants do receive $100 for each PET scan and $50 for each MRI scan completed. And we also have an ancillary study called Pointer Z, which, in addition to the lifestyle factors that are going to be examined as the primary Pointer trial, Pointer Z will also examine sleep, where participants would complete at-home sleep tests and use a watch light device, which would monitor their sleep at baseline, again at 12 and 24 months. And so for each sleep test that's completed, participants would receive $50 and also a summary report about sleep quality. And then with the Pointer study itself, as I mentioned, there are two arms to the study. And so there is a more structured arm, which includes meetings with an intervention team, and then a more self-directed arm, which still gets at the different lifestyle components. So, I think that the very exciting part of Pointer is that, we will be looking at these outcomes over time, over the course of 2 years, that there are multiple components that are the focus of the study, including diet, exercise, and social engagement. And if you would like to participate or are interested in participating in this, I do have some contact information here where you could contact to follow up more and find out more about US Pointer. And then finally, as part of the intervention component of Pointer, we do offer some small group meetings for participation. And that's all I had in terms of the study itself. Again, I want to thank Rush Generations for the chance to talk about the US Pointer study and its ancillary studies. And I hope that those of you listening would consider calling or emailing to find out more about the trial. And at this time, I'm happy to answer any questions that I am able to.
All right, thanks so much, Dr. Desai. We have one question from YouTube right now that's from Jim. It says, is the purpose of life assessment used in Rush research available without clinical appointment, or can it be self-assessed?
So could you repeat that again for me? I just want to be sure that I understand the question. Is the purpose of?
The purpose of life assessment used in Rush research available without a clinical appointment, or can it be self-assessed?
So I think by life assessment, that's like lifestyle assessments that would be part of Pointer. if I'm understanding the question correctly. And so that is a part of participating in the structured group that's part of the study. And those would be separate from clinical appointments, where people would have the opportunity to meet with intervention coaches to develop their assessments and through the tracking that occurs in the study.
All right, thanks so much, Dr. Desai. So for those on the phone, you can use *67 to unmute yourself to ask a question for Dr. Desai. And then also for those on YouTube, you can enter in your question there. But if there's no further questions, then we can, I'll pass it back over to Grizel.
Again, thank you so much for the opportunity to talk with you about Pointer today. And I hope you'll consider finding out more about the study. Have a nice day, everyone.
Thank you. Thank you for joining us. And if you think of any other questions, feel free to chat them, and then we can try to answer them. We can try to have the speakers answer them at the end. So now I'm pleased to introduce Dr. Rebecca O'Dwyer. Do you have the slides ready to go? I can stop sharing so that we can have you share your slides, Dr. O'Dwyer.
Yes, please. Thank you. Bear with me. Can you see my slides?
Yes.
Okay, thank you. And thank you so much, Grizel, and thank you to everybody at Rush Generations. And it really is an honor to be asked to give a talk with you guys. I've done this a couple of times and I enjoy it every time. So thank you. And thank you all for coming today and logging on to YouTube and listening and taking the time out of your schedules. So today I'm going to talk to you about the neurological issues in aging, in the realm of connecting, planning, and caring, and trying to just identify what's normal aging and what's abnormal aging, and how we can stay healthy longer, all in the realm of neurologic diseases. So what are we going to talk about today? So hopefully you won't be like this woman falling asleep. I'm going to break my talk up into 3 parts. We'll talk first about just natural changes that we see in aging. We'll talk about some of the most common neurological disorders, and then end on a positive note on how to maintain brain health. So we'll start off with the aging brain. Clearly, I'm a neurologist, so I'm biased. I think this is the most important organ that we have. I'm sure cardiologists would disagree with me. But I think, the aging brain is something that, as with every organ in our body, as we get older, it does age. And there is a natural aging process that we see. Aging depends on many things, some things that are in our control and some things that are not in our control. Just our genetic makeup, that's something that is out of our control. But if we look at our parents and we look at our grandparents and see how they aged, often that is how we are going to age too, that we will age in a similar fashion. The environment, and that's something that we can, to a certain extent, perhaps control, and to another extent, maybe we cannot control. But definitely that is a factor that is modifiable and that we can modify in a positive manner with respect to aging. And then lifestyle. Again, I think that's something that we all can modify if necessary, at least to a certain extent. And so really, when we look at how we age and we look at our loved ones and we see how they age, we have to always consider that there are many, many factors. And sometimes the process goes slowly, and then there are times in our lives when it might speed up. And so trying to identify the factors that we can control can slow down that process. So what's kind of the normal aging process, right? So as we get older, it's not uncommon for us to maybe have difficulty finding words, especially if we're tired. I just came off 2 weeks of call, and believe me, my trainees on Monday, I was having lots of word finding difficulties, and that was just because I was just exhausted. And so again, this is an example of a factor where getting good sleep can sometimes alleviate certain symptoms like word finding difficulties. Sometimes we might find that we have more problems with multitasking. So maybe earlier in your lives, you were a working parent and you were, serving up breakfast, making the school lunches, you were on the phone, you were doing all these things all at the same time. Whereas now it might be difficult to, make a sandwich while also be on the phone chatting to a friend. This isn't something to be worried about. This is just an effect or a symptom of just kind of, again, an aging brain. Sometimes people also notice mild decreases in the ability to pay attention. And some people catch themselves kind of drifting off in their own thoughts more and more. When these are minimal and mild and you can bring yourself back to the moment easily, it's not something to worry about. But just because your brain is aging doesn't mean that it stops working and that you can't learn new things. And so I think that's kind of a myth around aging, that sometimes we feel like, oh, an aging brain can't learn something new, sort of this, what's the expression? You can't teach an old dog new tricks. That's absolutely not true. Our brain never ceases to make new memories. And so lots of people later in life will go back to college or take a class and learn a new skill. And that is actually one of the keys to keeping your brain healthy and sharp. There have been studies that have shown that you can actually improve your vocabulary as you grow older and your language skills. So other things that are maybe less obvious but have to do with your aging brain, so sort of more on the physical end, not the thinking end of as we age, you might find that you have increased difficulty balancing, and that's a big problem. You might find yourself being a little bit less mobile and more prone to falls. And this is definitely something that we want to try and fight and try and keep people as balanced in the sense of when they're walking and moving and as mobile as possible for as long as possible. Because we do know there is a high mortality rate with hip fractures and then hip fracture repairs. And so this is definitely something that we'll talk a little bit about some more in greater detail later in the talk. So why does this happen, right? I said, like with every organ in our body, there is some wear and tear. Why does the brain age? And so often I will have an older patient and we'll look at an MRI of their brain, and there are usually these little dots kind of intermittently seen in their brain. And they'll ask me, what are those? They don't look good. And why does this happen? Right? I said, like with every organ in our body, there is some wear and tear. Why sorry about that. And I'll say, oh, don't worry, that's just the sign that you had a good life, and that you ate well and you enjoyed life. And so part of aging, it just does come from just wear and tear on our organs. And I think that's a concept that we can all easily understand when it comes to our joints. And the same thing happens to our brain. Certain parts of the brain, just because of their makeup, their cellular makeup, are more prone to shrinking. And I think in general, we all shrink when we age. And some of that just has to do with we lose elasticity in our bones, in our joints. We also just get a little dehydrated. So drinking a lot of water is actually a very good way to prevent shrinkage. And like that, again, like I said, there are certain parts of the brain more prone to this, or more prone to dips in oxygen. And because really the fuel that our brain cells need are glucose or sugar, but not too much, because that can actually damage the blood cells that supply the oxygen to our brain cells. And our brain cells need oxygen as well. And so over many, many years, there are highs and lows in both oxygen and glucose, and we see little scarring on the brain. And this is why it also leads to a reduction in the communication between the brain cells or between the neurons, which is one of the reasons why it might be harder to multitask, where in earlier days it was easier. And the reduced blood flow to the brain really is key. Because it is through the blood that our brain gets the oxygen and the glucose that it needs. Also just inflammation as a response to injury or disease. And so if we think about our bodies, our blood is constantly flowing throughout our whole body. So the blood that is flowing through your fingers now will get to your brain. So even if you have inflammation in one part of your body, those inflammatory markers that are maybe trying to solve the problem in one part of your body will eventually flow through your brain and can cause some very little irritations or damage. And this is why as we age, it has a cumulative effect. And so that's why as we get older, we actually start to see the effect. So it's almost like many minor little injuries that kind of over time accumulate, and then we see these symptoms. Oops. I wanted to talk a little bit about the idea of cognitive reserve. What is cognitive reserve? And so cognitive reserve is the brain's ability to work and function well, even when part of it is disrupted. And we know, and there have been many studies have shown that as we age, our cognitive reserve reduces. So for instance, like on Monday, I was kind of sleep deprived over 2 weeks. I was having word finding difficulties, but I was still able to function. I was still able to see my patients and teach my residents and my fellows. And so even though maybe my brain was very, very tired, my cognitive reserve clicked in and I was able to do the things that I needed to get done. As we get older though, this can decline as a symptom of the aging brain, and just not having as much ability to kind of bounce back from minor little injuries. And so often in times of when older individuals have infections, whether it be urinary tract infection or an upper respiratory infection, so a cold or a cough or something, often we see a greater decline in their cognition or their cognitive abilities. But once the infection is treated and they recover from it, they bounce back cognitively, they bounce back again. And so this is just all wrapped around the idea of cognitive reserve. Studies have shown that people with higher levels of education, people who are socially active, have a greater cognitive reserve and lose less cognitive reserve as they age. And then, and this kind of leads nicely to environmental and lifestyle factors, right? So going back to what's a modifiable factor and what's something that we can't modify. And again, just staying cognitively active, sort of this you'll lose it if you don't use it idea, is the best way to maintain as much cognitive reserve as possible. So let's look at the environmental factors, and again, that we can perhaps actively modify in a positive way. So medications, I think, you know, as we age, we do, for whatever ailment disease that we have will need medications. And so I'm not advocating that you stop taking all medications, but I think having a thoughtful conversation with your primary care physician or your geriatrician about, do I need all of these medications? Knowing why you take each medication and making sure that it is necessary, 100% necessary. Because it's something that I see in my epilepsy clinic for older adults, is that often they come in with a long shopping list of medications. And some of them are maybe 2 medications doing the same job. And so in this clinic, we will actually reach out to the primary care physician and work in partnership with them in reducing the number of medications a patient is taking. So this is sort of a call to arms for you, that you can be your own advocate, and just having an open conversation with your primary care will keep that medication list down. And we'll talk a little bit more about medications later. Other things like smoking, I think that's kind of a no-brainer, right? We know that smoking it's bad for every organ in the body, but primarily it takes oxygen away from the brain. Smoking is one of the highest risk factors for going on to develop a stroke and a heart attack. And so I think if you are smoking, it's never too late to stop smoking. Excessive alcohol, again, we all know the effects of alcohol on how we think, how we move, if we really do drink it in excess. And again, that's something just, I joke with my patients when I say your neurologist is Irish. I'm never going to tell you don't drink. But what I will say is don't drink in excess, everything in moderation. Insufficient sleep. Like I said, I can speak to that one myself. We really do underestimate the power and the importance of sleep, because it is during sleep that our brain does rest, it rejuvenates. It's also during sleep that our memory centers consolidate the memories of the day. So it's almost like they are put in one memory bank and then they get moved to another one where we keep long-term memory. So if you're not getting enough sleep, you're not giving your brain that time or chance to consolidate your memories. Lack of activity. I think, I can't stress that enough. Physical exercise is very, very important on many levels. It improves oxygenation, so it improves the amount of oxygen that your brain cells are getting. It also increases endorphins. Endorphins are kind of the happy hormone, so it helps your mood. Also, just moving and your brain and your muscles and your bones practicing that movement can also help stave away those balance issues that often come later in life. Poor diet. I think, again, if you talk to a cardiologist, they're going to tell you the same thing. A poor diet, if it's high in fat and cholesterol and low in fiber, you are going to clog your arteries. And again, you're going to decrease the amount of oxygen that's going to those brain cells. Heart disease, diabetes, we know that high levels of sugar are extremely damaging to nerve cells. And so that is often why, as we get older, and I've been primarily focusing on the brain, but I should also just take a little segue as you're to talk about our nerves. So our peripheral nerves, meaning the nerves that innervate our arms and our legs, they also age, and glucose or sugar is very damaging to these nerves. These are some of the thinnest, are some of the smallest nerves that we have in the body. And so over time, you might notice like numbness and tingling in your fingertips and in your toes. And when that happens, there really is no going back. That really is a sign that the nerves have been damaged. But to prevent that numbness and tingling from progressing all the way up, up to your wrists and your elbows is getting your blood glucose under control. So just keeping your diabetes under control is so important for many, many reasons. And then something else, another modifiable environmental factor that I think doesn't get enough attention paid to it is social interaction. A little social interaction, so not getting a lot of stimulus. Again, it's this idea of if you don't use it, you'll lose it, can also speed up the aging process of the brain. So getting yourself out there, meeting people, meeting the grandkids. And I know with the last year and a half that's happened, that has not been easy with the pandemic. But even if it is, I mean, you're on YouTube now, so you are clearly computer savvy and technology savvy. And so even just having those Zoom parties or Zoom chats or Zoom coffee hours are important, because we are social beings and our brains do thrive on social interaction. When we look at the human brain versus other animals' brains, a lot of our brain is actually devoted to navigating social situations and relationships and the social interaction. And so it really is important, no matter how hard it is, to keep those social interactions going. Calming drugs. So this is calming drugs that can harm older adults' cognition. So like I said, often as we age, we do need medication. I give medication to my patients, right? So I don't want to say that medications are bad, but we do have to just question, do I need this 100%? Do I need it at this dose? Could I do better with a lower dose? And also just to take in that, okay, I'm on this medication, I need to be on this medication, and I might get a little brain fog from it. Antihistamines for allergy relief really can cloud older adults. Antidepressants are kind of a tough one because, and we'll talk about this a little bit later, but just having a low mood can have a negative effect on your memory. So when you're taking an antidepressant, really have that open conversation with the provider who is prescribing it, whether it be your primary care physician or a psychiatrist or even a neurologist. It's finding that fine line between it helping your mood, but it not clouding your cognition. Sleep aids. I personally think that's one type of drug class that really we shouldn't be using. If you are taking a sleep aid, talk to your doctor, talk to a sleep specialist or a neurologist about sleep hygiene, because really sleep aids can be quite dangerous because they are so sedating, especially in older adults. Good sleep hygiene, just as a brief tangent, is no screens, including mobile phones, television, at least an hour before going to bed, and certainly not in the bedroom. And then if you find yourself after a half hour in bed that you are neither sleeping nor having sex, you need to get out of the bed, go to a different room, and read a book, read a magazine. Don't turn on the television, don't go onto your computer, don't go onto your phone. But just do something that is mildly stimulating. Some people like to listen to relaxing music, but not music that will wake you up. Do that for a half hour and then go back to bed. And again, wait a half hour. Again, there's no sex and you're not sleeping, you take yourself out of bed and you do the same thing. And you keep doing this until you fall asleep. And honestly, it can take some people a week, even a little bit longer, until they go to bed and they actually fall asleep. And what you're doing is training your body and your brain to associate bed with sleep and nothing else. There's also spoken like a mother of a young toddler who has had to sleep train him several times. So it definitely, some people pick it up faster than others for whatever reason. Muscle relaxants. And again, these are something that we sometimes see with lower back injuries, just to kind of help relieve the pain and things. They can be extremely sedating though. So always try for the lowest dose possible that will give you relief. Another common class of drugs, especially seen amongst male patients, are antimuscarinics, and that help promote the control of urination. And again, this is where we have this fine line of, we want people to be able to stay dry and not to have to wear, diapers or whatnot, and go about their lives. But we also don't want them to be so sedated that they can't interact with the world around them. And then antispasmodics, again, for the relief of cramps in the stomach, intestines, and bladder. Again, sometimes that's necessary. If you are, though, getting cramps and you're finding that you are constipated, then it might be better to just look at increasing fiber in your diet and sort of, or just increase fiber supplementation. Again, these are conversations that you can have with your primary care physician. So not to say that I'm anti-medication, I am not. Some medicines will be necessary to take, but I think educating yourself about the possible side effects and why maybe your cognition, or maybe you're just a little bit cloudy, or you're not as sharp as you are as you usually are, and relating it to a medication can sometimes help. Sometimes it's the combination of medications, and I often see this. I'm a subspecialist, so I add to this problem, right? Sometimes my patients, they have a cardiologist and they have a neurologist and they have their primary care physician, and then they see an endocrinologist. And unfortunately, as a subspecialist, I kind of work in this little silo, and I worry about the problem that I'm helping my patient with, as does the other subspecialists. And sometimes just having a very good relationship with a primary care physician or geriatrician and being like, hey, I have all these subspecialists and they're prescribing these drugs. Are you noticing like any combinations that might be interacting negatively with each other? And so really the role of a geriatrician or a primary care physician is to try and help coordinate all the different kinds of silos, so that somebody has an overview of your medication list and how it is as a whole affecting you and your cognition. And so that's just why I said, yeah, always talk to your healthcare provider about all the drugs and all the supplements you take as well. So a lot of the supplements that you get at GNC and all these herbal remedies and whatnot, you guys should realize that they are not FDA approved, meaning they do not go through the same rigor as medications that are prescribed and FDA approved. And so that does mean you might be taking a supplement of XYZ for many years and not having a problem. And then all of a sudden, you notice that you are having a problem. And it could be that behind the scenes, the manufacturer has changed, or even just the company was bought by a different company and now they are getting their ingredient supplies for somewhere else. Or what they say is in the tablet actually is not 100% in the tablet. And this is all something that the FDA regulates, but these supplements are not FDA regulated. The other thing about these supplements is that they can also interact with the medications that you're taking. So a very famous one, and one that every medical student can tell you about, is St. John's wort. Often people take it as a more natural cure for or aid for depression. But St. John's wort actually interacts with a lot of drugs and induces them. So you could be on, an antispasmodic or a muscle relaxant, not having any complaints, not having any deficits or a decrease in cognition. And then you take St. John's wort, and then all of a sudden you're feeling cloudy or you have a brain fog. And it's not actually the St. John's wort, but it's the interaction between St. John's wort and this other drug. So always tell your physicians about every supplement you're taking. I think we all know this, but it's always important to mention it, just the benefits of quitting smoking at any age. I have some of my older patients who are like, oh, I heard you don't see an effect until 10 years after you quit smoking, and I'm not going to live 10 years, so what's the point? Not true. And we actually see positive effects a lot sooner, really within the first month of stopping to smoke. So if you think you're going to survive the next 4 weeks, it is worth quitting smoking. And we know that it lowers the risk of heart attacks, it lowers the risks of stroke and lung disease, and it improves blood circulation. So again, then your brain is getting more glucose, more oxygen, and also you're not exposing other people to secondhand smoke. Oops. Oh, wrong way. I beg your pardon. Okay. So we'll just briefly talk about the effects of alcohol on the brain. So alcohol is a very, very potent, I'm just going to call it a drug because it is. It really does, when you drink it in excess, change the chemical makeup of the brain and also the brain cells. And so when you drink in excess, actually your brain cells produce a lot more of one certain type of receptor. It really has a profound effect, which is long-term not good for the brain. And so we know, with excessive alcohol intake, things that you will see is slurred speech, drowsiness, dizziness, poor driving. Even moderate use can slow and impair communication between the brain cells, again, because it changes the chemical makeup of the brain. We know that long-term, we see changes in balance, memory, emotions, not so emotions, but also emotion regulation, coordination, and body temperature. Just because of kind of the cellular makeup of certain brain cells, because we don't just have one type of brain cell, we have actually very many types. And the parts of the brain that control, for instance, balance, coordination, the cerebellum, this green part here, are very prone to alcohol use. When I look at an MRI of an older individual, I can usually tell by looking at their cerebellum whether they drank a lot during their life or not, and I'm usually right. Other parts of the brains that again are more prone to damage from alcohol are the temporal lobes here, where we make memories, the parietal lobes, where we actually integrate kind of the thought of, I want to move, I want to point to my head. And so the parietal lobe makes sure that I activate all the right parts and that I actually touch my head. And then the frontal lobes, and our frontal lobes are kind of our filter. So our frontal lobes are the part of our brain that says, I want to say something nasty to this person, but I'm not going to say it. Our frontal lobe says, but I'm not going to say it. And again, I'm maybe speaking like the mother of a toddler because his frontal lobes are not online yet. But this is a part of the brain, again, that is particularly susceptible to damage from alcohol. And it's why we see with long-term alcohol use a reduced ability to regulate emotions. Effects of diabetes. So those muffins look good, but there's a lot of sugar. We know that glucose or sugar damages blood vessels throughout the body, including the brain. So the brain doesn't get a dispensation. The blood vessels are damaged to the same extent. And also, I talked a little bit about earlier that the numbness and tingling in our fingers and in our toes, it damages the nerve endings in the limbs. We know that diabetes increases the risk for stroke and heart attack. And it also increases the risk for memory problems and Alzheimer's disease. Actually, we just in the neurology department just yesterday had a grand rounds about even pre-diabetes is now associated with a higher rate of cognitive impairment and Alzheimer's disease. So while glucose is the fuel that our brain cells need, too much of it is bad, and too much of it will damage the brain cells and the blood vessels. What is sleep apnea? So I think I talked about kind of the importance of sleep. and how this is the time when our brain kind of rests and rejuvenates itself and consolidates memory. Often a reason for poor sleep, and you might say, well, I go to bed and I sleep for 8 hours and I wake up in the morning and I'm still exhausted. I still feel like I haven't had a night's sleep. And that's really, you should be telling your physician about this, because you might have sleep apnea. And what is sleep apnea? Sleep apnea is when you have brief pauses in breathing, or periods, or brief pauses in, or brief periods where you don't breathe during sleep. And so when you're not breathing, your brain is not getting enough oxygen. And it's characterized by snoring. So if your partner is snoring, you might hear that they snore, and I'm not going to do it, and their snores get louder and louder and louder. And then there's like a pause. There's like that awkward pause where there's neither air going in or out of their body. And then they just kind of like, it's almost like they wake themselves up and then they start breathing again. And so if you can imagine doing this throughout the night, your brain is never getting enough oxygen. And also just this pause where kind of you have this crescendo of snoring and then you stop. Actually, what happens in the brain is your brain wakes itself up and kind of activates your breathing centers for a drive, because you've actually stopped breathing. And so we can see when we look at EEGs, which are brainwave tests, that these people never get into deep sleep. And so that's why in the morning you wake up and you feel like you have not slept at all. And there's often daytime sleepiness. And so, like I said, if your partner snores and they're waking up tired, it probably is a good idea to talk to your primary care physician and maybe get a consultation with a sleep specialist. I have also seen people who, after they get the CPAP machine, their cognition improves immensely. So again, this is one of these modifiable factors that we can control. So effects of sleep apnea, like I talked about, memory loss, and that really is because your brain cannot get into deep sleep, which is where and when the brain consolidates memory. It leads to high blood pressure. As you can imagine, if you stop breathing, the linked with breathing is also your heart rate, and your heart is pumping your blood. And so if that stops, the body just creates a lot of high pressure to just keep that pushing that blood through your body. And stroke. Stroke is also a risk factor. Often people with untreated sleep apnea tend to have their strokes in the middle of the night, kind of while they're asleep. And there's more and more research being done on this, and we do think it is directly linked to just kind of that kind of the loss of your drive to breathe. Treatment, lifestyle changes. Sometimes when we gain weight and we kind of gain some jowls, if you can think of as you're lying down, that pressure is kind of pushing everything down. And you can see here, this is your tongue, and it basically closes off the windpipe. There are special devices, like I said, CPAP machines. You know, my father has sleep apnea, and he's like, oh, I'm not going to guess a CPAP. Those machines, they're loud, they're noisy, they're uncomfortable. And I'm like, no, actually they have really, the technology has advanced greatly over the last 10 years. And they come in all types and shapes and sizes. And a good sleep specialist can really make sure that you get something that is comfortable and fits you. And is not too loud. The machines have also got a lot quieter over the last 10 years too. And honestly, sometimes people will start with the CPAP and not like it and feel like it's uncomfortable, but they'll wake up the next day and feel for the first time in many years so refreshed that they're like, I don't care, I will put it on just to get a good night's sleep. Okay. So the effects of heart disease and high blood pressure. So again, this is kind of, I feel like I'm like a chipped record here. There's kind of a theme. Heart disease, high blood pressure, it leads to damaging the blood vessels, which then in turn decreases the blood supply to the brain and to the nerves. And we know this increases the risk for stroke and also for dementia, for cognitive problems. And while I joke with my cardiology colleagues and I say the brain is the most important organ, they always say the heart is the most important organ. And honestly, both organs are inextricably linked physiologically, maybe not atomically, but physiologically. And so when one is not doing well, the other is not doing well either. And so it really is important to take care of your heart, because if you have a healthy heart, it's a lot easier to have a healthy brain. Oops, sorry. So let's go and talk a little bit about just common neurological disorders that are seen as we age. So let's just start with the big elephant in the room, dementia. So what's normal and what's not? And I think whoever got this tattoo was a genius. I could probably do it, that tattoo. And age-related forgetfulness. So when it's just part of the normal aging process, it does not make daily activities difficult, okay? It does not affect your daily activities. You can go about your business, you get it done without any difficulty. Signs of abnormal forgetfulness, though, are when you keep asking the same question over and over again, or you might not realize that you're doing it, but a loved one will be like, honey, I told you that 2 times already. So when you receive that message from people around you, that's kind of a cue that maybe you've been asking the same question over and over again. Other things like getting lost in familiar places. So if you're somebody who takes a walk around the neighborhood every day, and then you find that it's getting harder and harder to take that walk and not get lost, that's another red flag. Being unable to follow instructions. So by the age of 3 or 4, everybody should be able to follow what we call a 3-step command. So in the case of, and I'm just going to give this example of my 3-year-old, he should be able to take his shoes off, put them on the rack, and bring me my bag. And so if you're finding yourself with people are asking you to do things, and you, after doing the first thing, you can't remember what the other 2 things were, or you do 2 of them and you can't remember what the third, and this happens on a regular basis, that's when we have to start worrying about, is there something else going on with your cognition? And then becoming confused about time, people, or places. I think that is also something that, again, it's a red flag, especially when it's familiar places and familiar people. Often when you go to a neurologist, we do a mental status exam. And one of the common questions that we ask is, who is the president? And when I did my residency at Georgetown, I was in DC, I did it during the Obama presidency. And I think Obama's presidency was so iconic. Everybody knew it was President Obama. The funniest, I think, response I got from an older gentleman who indeed did have mild cognitive impairment was, he was like, I asked him, who's the president? And he was like, it's that damn Bill Cosby. And so clearly he knew it was not a white male. But he didn't get it right. And so that is a red flag. So what are some signs? So you don't just go from fully cognitively intact to having end-stage Alzheimer's disease. It is, unfortunately or fortunately, a slower process. And so on kind of the continuum of cognition, people first will have what we call mild cognitive impairment. So this is where you're a little bit more forgetful than what is considered normal aging. And sometimes it's hard. Sometimes it is very hard as a clinician to decide, is this normal aging or is this beginning of mild cognitive impairment? Often very high functioning, intelligent people are acutely and vastly more aware of any little decline in their cognition or their memory. And so sometimes it's like, well, you're super smart and you realize that you're not as sharp as you were maybe 10 years ago, but I think this is aging. But sometimes it's like, no, you're super smart and you're aware you're not as sharp as 10 years ago, and I think you have mild cognitive impairment. The other thing about mild cognitive impairment is even if you are diagnosed with that, that does not mean 100% that you are going to go on to develop dementia. And in this mild cognitive impairment kind of realm, that is when you really have to get serious about modifying environmental factors, lifestyle factors, health factors, and that could be negatively impacting your cognition. So common signs of mild cognitive impairment include losing things often, forgetting to go to important events and appointments, so missing some doctor's appointments, or missing a grandchild's graduation or birthday, and having significant word finding difficulties. So all the stars are aligned. You've had a perfect night's sleep. You haven't touched a drop of alcohol. You've been eating well. You're not stressed out. You're not depressed, and you're still having difficulty finding common words, like being like the thing you write with, right? When you can't find the word for pen. And what should you do? First of all, you should approach your primary care physician, and they will probably send you on to a neurologist or a geriatrician who will do some sort of memory testing with you. And then unfortunately, it's watchful waiting. We follow it. And you'll have to visit your doctor probably every 6 or 12 months. And like I said before, though, that's when you really have to up your game and start doing things and activities and changing your lifestyle so that it will help maintain your memory and your cognitive skills. So sometimes people do go on to develop dementia. So here's kind of, I like this this graphic because I think it compares what's normal here, normal aging here on the left versus what we see in Alzheimer's disease. And unfortunately, it's often when we live with somebody or we're in close contact with our friends, this process happens very slowly over time, and we might not notice it ourselves, and even our loved ones might not notice it. And it's not uncommon that in the time between Thanksgiving and Christmas or in January, neurologists get a lot of calls from just concerned younger relatives where they're like, hey, I had Thanksgiving dinner with Uncle Joe and I haven't seen him in 2 years, and whoa, his memory's shot. And so sometimes even the people around you who see you every day, day in, day out, might not pick up on it for a long time. So normal aging, we all make a bad decision. We all have a bad day. And this can happen once in a while. But when a loved one or you find yourself making poor decisions and poor judgments a lot of the time, that's a problem. Then you need to question, what's going on here? Again, I think we've all missed a monthly payment on something. But the problem is when you can't balance your own checkbook, when you just can't keep track of your monthly bills and your finances go into disarray. That's another sign that something is awry. And forgetting which day it is and then remembering it later. And again, I joke, I think especially in the pandemic with just the social isolation, where we have not been going about our business, where we haven't been able to keep our regular routines, where we have been stuck inside more, it's even more difficult to keep track of which day of the week it is, what we should know the month, but what date it is, especially, like I said, when we're doing social distancing and every day is just the same, this does become a little bit more difficult. But you should eventually, without too much of a bother, be able to remember what day it is. When you lose track of the date and even the time of year, then it's a problem. So if you cannot tell what season it is, that's a big problem. Sometimes forgetting which word to use, right? Again, this kind of word finding difficulty, it all happens to us, especially in times when maybe we're nervous or we're upset about something. Again, very normal in normal aging. But if you're having trouble following a conversation, or you can't hold a conversation with somebody, that again, it's a red flag. That's probably dementia. Losing things from time to time. I mean, I think that happens to us all. My 9-year-old, I swear if his head wasn't screwed on, he'd lose it. He doesn't have Alzheimer's dementia. And this is just something that it's just normal. And some people, if you're somebody who is like my 9-year-old, who always lost things from time to time, and you're still doing it, you know, in your 60s, your 70s, your 80s, that's probably just you, and that's okay. But it's when you start misplacing things often, or more important objects, and you're unable to find them, when you have no idea where they are, that becomes a problem. I just had a dear patient of mine that I've now been following for 5 years, and his wife, and his dementia has progressed. And I said to her, I said, you know, how is it going? She's like, oh, it's okay, except I can find a shoe in the dishwasher now. So those sorts of things, right? You know then that there is definitely something right. So Alzheimer's disease, what is it? So Alzheimer's disease is basically a buildup of harmful proteins that form what we call these amyloid plaques in the brain. And these plaques cause the death of brain cells, but they also cause the loss of connections between the brain cells. It's kind of like they clog up the works. And so again, as with everything, unfortunately, there are certain parts of the brain that are more prone to these plaques than others. And there's been a lot of research has been done on this. And unfortunately, some part of normal aging is the development of these plaques. And so it's where on that spectrum does normal become abnormal. And so that's where you need a memory specialist or a neurologist. And there are special scans that we can do where we know where the threshold is. We're like, nope, this is fine, this is just normal, or versus, no, this is abnormal, this is Alzheimer's disease. Known risks are age. So we know because these plaques are kind of part of the normal aging process. So as you get older, you will have more. One of the risks is age. So the older you get, the more likely you are to develop Alzheimer's dementia. Genes. I think, again, I said at the beginning of the talk, if you look at how your parents aged, that's probably the best indication of how you are going to age. And head injury. We also know that head injury, for whatever reason, accelerates the production of these plaques. Other mimics, and this is very, very important. Some of the big mimics of Alzheimer's disease, and I should have put this, and I am surprised at myself that I did not put this on this slide. One of the #1 mimics of Alzheimer's disease is actually seizures. We always think of epilepsy and seizures as being a disease of the youth, but actually 1 in 4 newly diagnosed patients with epilepsy is age 65 and older. And seizures in the elderly are often what I like to call a treatable cause of dementia, because we know with every seizure, cognition in older people, because of that smaller or lack of cognitive reserve, takes a bigger hit. But if we control the seizures, usually cognition bounces back. Maybe not 100% to what it was before, but definitely improves. And so again, if you have a friend who all of a sudden just is declining rapidly or quickly, one of the things you should be thinking about is this person having seizures? And seizures in older individuals tend to be, because the brain is older, tend to be much more subtle than seizures in younger people. So when we think seizures, we often think of those big convulsions where people shaking and, on the floor of the supermarket. But in older individuals, it can be something very subtle, like just a blank stare off for 30 seconds. Or it can be they're chewing, but they don't have gum and they're not playing with their denture. So again, for maybe 30 seconds. Or something just very natural, like they're just wringing their hands, but your friend isn't responsive to the world around them. And that could be a sign of seizures. Other mimics are hearing loss. So when I talked about one of the red flags being unable to hold a conversation or follow a conversation, especially now with the pandemic and everybody's wearing a mask, we don't realize how good of lip readers we are. And so people with hearing loss, of course, if you can't hear the conversation, you're not going to be able to follow it. So that's something else. And again, hearing loss, again, kind of occurs on a slower time scale, but it's definitely something you should definitely check in with your audiologist every couple of years and make sure that your hearing is good. And I mean, now hearing aids they're much neater, they're less clunky, they're easier to manage. And really, again, cognition will bounce back. You'll be able to have those conversations again if you can hear what's going on. Depression, mood, this is sometimes the toughest thing to explain to patients, is that link between mood and memory. And I think we're going to talk about it in a couple of slides. So I'll move on to confusion secondary to medication. And I think we talked about that earlier in the talk in great detail. Okay. So there are some therapies that can treat Alzheimer's symptoms, but they do not slow down the disease changes in the brain. I think there's been a lot of hoo-ha about this new Alzheimer's drug that was kind of sped through the FDA. I've looked at the studies for myself. I don't think they are convincing. And I do tell my patients it's a very expensive drug that not many insurance companies are covering. And so I advise my patients, if your insurance company is not going to cover it, I would not take it, because I personally do not believe that it is effective. We could have a debate about this for hours and hours, but I did want to just briefly address it. Things, though, that will reduce and show a lot of promise, probably just as much promise as this new drug in reducing the risk of cognitive decline or Alzheimer's, is exercise. Again, just pumping that blood through your body, making sure your brain cells are getting enough oxygen, enough sugar, glucose, a healthy diet. Again, they're not getting too much sugar, but they're getting all the nutrients that they need, controlling high blood pressure, diabetes, heart disease. And then, like these two gentlemen playing chess, cognitive brain training. Now, you don't have to play chess. What I tell my patients is read. So other than the part of the brain that directly sends the signals for your limbs to move, reading really uses all other parts of the brain. So if you can read something that has a storyline, you're activating the visual part of your brain, because you're imagining these pictures. You're activating your frontal lobe because you're interpreting how the characters are reacting or interacting. You're activating your association cortex, or the part of your brain that associates things, because you're trying to keep the storyline clear in your head. You're activating your memory, because to follow the novel and to follow the story, you have to remember what went beforehand. So in my mind, you absolutely need physical exercise. And I think the best brain exercise you can do is reading. And often I will see with my patients who maybe have mild cognitive impairment and go on to have dementia, is they come and they tell me, yes, they are going through the Russian classics, and they're reading Dostoevsky and all of those guys. And then maybe like a year later, they're reading a John Grisham novel. And then a year after that, they've gone to the Reader's Digest. And so if the complexity of what they're reading has gone down, and because their cognitive abilities have maybe also declined. Now, that's not to say if you're like, well, I don't like the Russian classics, I never liked them, that's okay. And if you're like, I like my Reader's Digest, good for you. That doesn't mean that your cognition is any worse or any better than anybody else's. But I think it's just important that you read something with a storyline. So not just a series of facts, but really some sort of storyline. Because like I said, for all those reasons, it really does engage all of the brain. Depression. So this is sometimes one of the hardest things to, in some ways, sell to my patients and to family members, because often we think of our feelings being separate to what we think or cognition. And really, they are inextricably linked. And so depression is actually very common amongst older people. Feelings of sadness or loss of interest in favorite activities that lasts for 2 weeks is how we define depression in older individuals. And I also think, again, just with the pandemic, I don't think anybody's mental health at the moment is in a great place, whether you be young or old or working or not working. And so I think it's important that we take time to be good to ourselves. And the reason why the common symptoms that we see with depression, along with these feelings of sadness and loss of interest, is memory difficulties. And why is that? So the part of our brain that makes memories and consolidates memories is called the hippocampus. The hippocampus is an integral part of our emotion system, which is called the limbic system in the brain. And some of that is because when we make memories, we remember how they made us feel, right? So I'll remember my son's 3rd birthday party or my son's nine-year-old birthday party, and it makes me feel happy. And that's because the hippocampus that makes memories is part of that emotions system as well. And so often when we're depressed, we have great memory difficulties because that part of the brain is affected and just cannot make those memories or cannot consolidate them the same way. Along with depression comes sleep problems. So we're not giving our brain the opportunity to rest and rejuvenate. Often people get confused or they can't hold their attention on anything. We see a change in appetite that can either lead to a weight gain or a weight loss. And really, in its most severe form, people will have suicidal ideation or even go on to attempt or commit suicide. Depression is not a normal part of aging. And I think that's also something we need to be aware of. There is such a thing as reactive depression. So when we lose a partner, when we lose somebody that we're very close to, it can be part of the grieving process to become depressed. But when that lasts longer than 6 months, then it no longer is considered grieving, but is considered depression. So some medications can cause depression as well. I talked about the reactionary or situational depression. And again, if it persists longer than 6 months, then it becomes its own thing. Treatment often can include an antidepressant. Again, we talked earlier about sometimes they're a little bit sedating, and also psychotherapy. Often, in my experience, a combination of both, especially in the most severe cases, is what's most successful. And again, I just think in the setting of all that we have been through with the pandemic and the social distancing and the social isolation, we are social creatures. Our brains are wired to be social creatures. I think we all need to be good to ourselves and also not be afraid to say, hey, this has taken a toll on me and I think I might be depressed. Or just looking at our community and looking at our friends and being going, maybe Mary is depressed. Mary's not her usual self. and helping our friends and naming our feelings and just being okay with saying, yes, I'm depressed and I'm going to get help. Parkinson's disease. This is also very common, is another common neurological disorder. This is a picture that every medical student sees. And there was a famous pathologist back in the 1800s called Netter, and this is his drawing of somebody with Parkinson's. And the signs include shaking, this kind of pill rolling tremor like this. People are often rigid and they find it difficult to initiate movement, and they're also just slow to move, which also leads to difficulty with walking. And so the symptoms are caused by a buildup of proteins, different proteins to Alzheimer's disease, but they build up into what we call Lewy bodies. And this leads to the death of a particular group of brain cells that produce dopamine. And so you can see also just here, Netter's drawing, the man has a stooped posture that often comes with Parkinson's, and what we call this masked facies. So he does not emote. And often people with Parkinson's speak with a very low monotone voice as well. There's many, many treatments for Parkinson's disease. I just, I don't know if you know the film. It's a good film. It's actually historically pretty accurate about just how the treatment for Parkinson's was discovered. And it is, honestly, we have medications that just increase the amount of dopamine in the brain. So because those Lewy bodies are killing these dopamine making neurons, we just increase the amount of dopamine in the brain. Obviously, it's a progressive disease. So again, we cannot stop it, but we can definitely slow its progression down. Other newer treatments are what we call deep brain stimulation, where they put these very, very thin wires into a certain part of the brain that controls the tremor, and they stimulate your brain. You are completely unaware of it on other than you don't have a tremor, but you don't actually feel it in your brain. The irony of our brain is, even though it's made up of brain cells that are neurons, that are nerve cells, it isn't what we call innervated. So you can be awake and somebody can touch your brain and you will not feel it. It's kind of wild. Other things that will help with kind of the symptoms of Parkinson's disease is speech therapy, where they teach people to speak loud and proud, and then also physical therapy around preventing falls. And I feel like I've spoken too much. I'm taking up a lot of your time, I'm sorry. We'll just talk a little bit about brain injury and fall. So older adults are at higher risk of falling, and this can lead to brain injury, whether it be in the form of a brain bleed or a fracture to the skull. And factors that contribute to this are muscle weakness, again, that loss of sensation in the feet, and what we call postural hypotension. So if you get up from the sitting position too fast, you might feel the room and kind of swerve. And that's probably because your heart can't keep up with the need of oxygen or blood to your brain. And so sometimes it's just increasing the amount of fluids that you drink and just getting up slowly. Sometimes just not seeing well, right? If I can't see well, if I have a cataract, I'm more prone to bump into things and then fall and injure myself. And other things like cluttered surroundings. So rugs and mats, those are always fall hazards because people can just trip up on them.
Dr. Dwyer?
Yeah.
This is Grisel. We have many questions in the chat for you.
Oh boy.
We have about, we would like to set at least 5 minutes for those.
Okay, I will go very quickly. I apologize.
No problem. It's great content.
So how to reduce the risk: maintain physical activity, exercise to improve balance and coordination. Like I said, stand up slowly, declutter your home, go to your optician once a year, and limit alcohol. So stroke, I just want to cover this very, very quickly. Stroke, it's sometimes called a brain attack. And this is when blood flow to the brain is stopped. It's either caused by a clot that's in a blood vessel or by a bleed. And I think we talked about a lot of the risk factors before, being high blood pressure, high cholesterol, and diabetes. And again, these are modifiable risk factors that you and your primary care physician can get under control. Things to look out for are sudden acute numbness or weakness of the face, the arm, the leg. It's often one-sided, or suddenly you're speaking gobbledygook, or you're mixing up your words, or you can't understand. Or if you have trouble seeing in one or both eyes. So again, it's just kind of this sudden onset of these sorts of symptoms. And I really like this FAST. So if you notice in either yourself or a loved one that their face, so FAST, so F for face, if their face looks uneven, ask them to smile. If their arms, if one arm drifts down, ask them to raise both arms. If their speech sounds strange or it's slurred, ask them to say the grass is green. And then if you notice any of these, call 911 because time is brain. Also, don't ignore mini strokes, or what we call TIAs. They are usually the warning that the big stroke is about to happen. So don't just brush it off. Oh, it went away after a half hour. Still go to the emergency room and still ask to be seen by a stroke doctor or at least a neurologist. There are many treatments depending on what the cause of your stroke is. Really, and it can be even just going up into one of these vessels and removing the clot. We can also do it with medication as well. And really what we as neurologists try to hit home is preventing the next stroke. Because just because you had one stroke does not mean that you are done. There's about 750,000 strokes a year in the US alone, and only about 600,000 of them are first-time strokes. So that means 150,000 people a year have at least their second stroke. Treatment, often if the brain is damaged, we really can't bring it back, but it's rehab and just working with the new kind of physical limitations that you have. How to maintain brain health: take care of your health, eat healthy foods, be active, learn new things, read, and connect with family and friends and communities. And don't skip those recommended health screenings. Manage your health problems like diabetes, high blood pressure, high cholesterol. Don't be shy to ask your doctor about your medications and are all of them necessary. Quit smoking, don't drink in excess. Eat healthily. I think we all know that. I'm not gonna, and get moving. We know that physical activity reduces the risk of diabetes, heart disease, depression, and stroke. It helps prevent falls. Guidelines are recommending about 150 minutes of exercise per week. That sounds a lot, but if you took 3 10-minute walks 5 days a week, you would hit that goal. And I also say, just, find a buddy, or like, there's a name for it. They're called somebody that will hold you accountable, an accountability partner. So tell your friend, hey, I'm going to do this. Dr. O said I got to walk 150 minutes a week. You ask me next week how many minutes I walked. Keep your mind active. Like I said, read, teach, take a class. You guys have more life experience than anyone else around you, and you need to teach us. So, teach a class, start volunteering, share your wisdom, and stay connected, right? People with meaningful activities report feeling happier and healthier and have a lower rate of dementia. I talked about the accountability partner. Write it down, tell a friend. And yes, I guess I got to the end very quickly. Sorry about that. The other thing I just want to make a plug for is I do have a neuroimaging study that I'm trying to enroll healthy volunteers. You would get a free MRI. So please feel free to ring my clinic, and then we can get you in contact with the correct person. So I guess I'll open it up for questions. Or
Great, wonderful, Dr. O'Dwyer. Thanks so much. All right, so one question in the chat is, do individuals experiencing early signs of dementia or cognitive decline. So they tend to report any increase in anxiety, or even if it's about being nervous around interacting with others.
So, and that's a really good question. So it can be. I find that the smartest of people are, like I said, acutely aware of any decline in memory or cognitive ability. And that often does lead to anxiety and depression sometimes as well. I think the only way, though, to tease these two apart is really to go to, either a neurologist or a psychiatrist. And sometimes we would send the patient to a neuropsychologist to do a very formal cognitive test over about 4 hours. And they can prize apart what is emotion and what is actually cognition. So it can be seen.
All right, great. The next question is, do we know if virtual interaction is as similar to in-person for like as a way to improve brain health, or is it just better than none?
So we don't, I will admit, I don't know. I haven't read any studies yet, but I definitely think it's better than none, right? And I think in this era of the COVID virus, right, you want to keep yourself safe. You don't want to expose yourself. And so that being said, I should say, just get the vaccine if you don't have the vaccine. But that being said, virtual is better than none. But I think what we're seeing, and I think what everybody has kind of experienced this summer as things opened up again, it's just better in person.
Mm-hmm. Absolutely. All right. So how prevalent is alcohol-induced neuropathy, and how is that cause really determined? That might be more of a medical question to ask your provider, but
right.
Mm-hmm.
So I think amongst alcoholics, it is very common. And I think, one of the things that when somebody comes to me with a neuropathy is I will ask them about their drinking habits. Again, this is something we learn in medical school. Usually people aren't 100% honest about their drinking habits, especially if they feel like they're drinking too much. And so there are tests that we can do. There is lab work that we can do that would indicate one of the reasons for the neuropathy could be alcoholism.
All right. Let's see. So there are a couple questions about MCI. How would you differentiate between forgetfulness and MCI? Like, is there an objective test for that?
So there is. And again, it's very difficult to distinguish sometimes one from the other clinically. And so if you feel like I can't do this watchful waiting and I can't just see if this is going to progress or not, I think what we can do is we can send our patients, like I said, to a neuropsychologist who again has very discrete tests with cutoffs. And then at a certain cutoff, it goes from just normal forgetfulness to mild cognitive impairment.
Right. Great. And then, yeah, for, let's see. So that is about all the time we have for questions. I will go ahead and put our Rush Generations email in the chat for people if they have follow-up questions or if you didn't get your questions answered, and then we can try our best to connect you. So I'll pass it back off to Grizel to thank you, Dr. O'Dwyer, and everyone for attending. So
thank you so much for this opportunity.
Thank you. Thank you so much for all that critical information. Not only, especially, well, there's so much, but the characteristic of normal aging, people a lot ask about that and when to consult our primary care physicians. And thank you also, Charte and Dr. Desai, for the information about the Pointer program, how to prevent Alzheimer's disease, which is also a progressive neurodegenerative disease we need to pay attention to. So thank you again for your participation, for joining us today. I'm trying to, let's see, very briefly, I would like to help to tell people about upcoming programs, but now my Okay, finally, next. So it wasn't progressing, but know that we have many of the programs, health promotion programs that help you with what the providers today were discussing in terms of staying active and healthy. One of them is our self-management workshops called Take Charge of Your Health. We are recruiting for one of our upcoming workshops starting very soon. So always keep that number, the 1-800-757-0202 handy, so that you can join not only those workshops, but others like this one, the Walk with Ease. We are starting a partnership with the Garfield Park Conservatory. And especially for those of you very close to that area, feel free to give us a call, because we are having this walking program. Is an evidence-based program that we are very happy to bring to you. Please give us a call. Another one that is also very helpful to you is the mindfulness one-on-one. This is a very limited number of people that we're able to have in each class, but feel free to call us because we have one starting very soon. September 9th is gonna be here before we know it. And also RAP for seniors, also attending to that emotional health that is so important. And one of the new exciting news is that we're gonna have also a session very soon, starting in September as well, but in Spanish. So again, 1-800-757-0202 will answer your questions and give you additional information. We continue to have other support groups, including the coping and connection with the times of COVID, with all the new developments with the COVID-19 and the Delta variant and all of that. People are finding this support group very helpful to them. And finally, the diabetes education support group. Oops, so sorry, I went too far. But diabetes and education support group is another one that is available to all of you. And talking about social interactions, right? Social connection. The Friendly Color program is another of our newest programs that get exactly to that, making sure that people are not feeling as lonely and as isolated. So give us a call. The caregiver initiatives continue to offer that support to caregivers or family caregivers of older adults. So that number is different, but feel free to call us at the 1-800 and we will connect you with that staff if that's easier for you. And of course, always we are delighted to get your feedback or information or your thoughts, or what is it that matters most to you as you hear all these topics, as you engage in health promotion programs. Why is it that you're doing that? Why is it so important for you to be staying active, staying healthy, having interactions with others? We want to learn from you. So that's a neat program that is available to you. But for now, it's Rush Generations, 1-800-757-0202. Make sure to call us and we will get you to the right person, to the right program. So thank you so much to all speakers and for you to join us.